It is a mood disorder which can be mild, moderate, or severe by nature. Depressed patients suffer from disability and distress as patients with chronic medical disorder such as high blood pressure, diabetes, heart disease, and arthritis. If at least 5 of these symptoms are present persistently for a duration of 2 weeks, the patient is considered to be suffering from depression. These could be the symptoms: persistent low mood, loss of pleasure or interest in daily activities of life, loss of energy or easy fatigability, significant weight loss or weight gain, insomnia or hypersomnia, feelings of worthlessness, helplessness or hopelessness, decreased ability to think or concentrate, or indecisiveness, recurrent thoughts or wishes for death, or suicidal thoughts. The patients usually have poor social and occupational functionality and has tendency to indulge in substance dependence. Their immunity to physical illness is also low. Recovery from depression is possible by appropriate treatment, but relapse is common and care over the long term is essential. Depression runs in families, reflecting an inherited vulnerability. 23-year-old Asghar is a case that can give us an insight about the behavioral change in a depressed patient.
अब आप अंदर से कैसा महसूस कर रहे हैं?
अंदर से बहुत बुरा महसूस, टूटा हुआ, किसी चीज में भी दिल नहीं लगता, न टीवी देख पाता हूँ, न पढ़ पाता हूँ, रात को भी सोने की कोशिश करता हूँ, नींद नहीं आती, ख्यालात आते रहते हैं दिमाग में।
आपने मुस्तकबिल के बारे में क्या सोच रखा है?
मुस्तकबिल में मुझे कुछ भी नहीं नजर आता, तारीकी है सिर्फ। I mean, there is no light at the end of the tunnel.
There is equal strong evidence, however, that childhood experiences such as loss of a parent also produce vulnerability to depression, and losses experienced in adulthood can precipitate depressive episodes. Depression is thus both biological and social in its origin. Medication and psychotherapy both have been shown to be effective in relieving depression. Children too can become the victims of depression.
So if we take a scenario like Pakistan, Pakistan has got a lot of problems, and each and every one of them affects the developing child's mind and brain. As we said that the child's mind requires healthy set of parents with a healthy attitude toward the life and a good schooling. Now if you look at the Pakistan scenario in the last 15 or 20 years, it has had a very unstable scenario, especially from the point of view of law and order, economic scenario and educational scenario. Now I personally feel that these three things have very adversely affected our growing children, because the child, for a child to grow normally, it's just not a physical growth, it's an emotional growth, it's a psychological development, it's an intellectual development. All these factors were affected.
The worst consequence of depression is suicide. It is estimated that between 40% to 70% of all suicide victims in the United States suffer from major depression.
जिंदगी मेरे लिए बेमकसद और बेमाने रह गई है। मैं किसी के काम की नहीं। नाकामियाँ, दुख, बेबसी, नातमाम आरज़ुएं, उम्मीद की कोई किरण नजर नहीं आती। हालात कभी नहीं बदलेंगे। मेरे लिए मर जाने से बेहतर कोई रास्ता नहीं। प्यारे अम्मी अब्बू, मुझे माफ कर दें। मेरा वजूद आपके लिए बोझ से ज्यादा कुछ नहीं। काश ऐसा सब कुछ ना होता। काश।
Depression is now seen at younger ages as well, and in great frequency. To make the best gains in public health, it is essential to train primary healthcare physicians to recognize depression and treat it appropriately with drugs and counseling.
When a person is totally frustrated, what he does, he hurts himself, he commits suicide. It is his way of saying that, look, nobody is bothered about who I am, what happens to me. And so there is no point in my living. And so that is why in our present day society, suicide is on the increase. The increasing rate of suicide, I think the attitude should change. I think we should be more caring and we should be more tolerant of the mental illness. I think there should be more provision for identification and for adequate treatment of the depressive illness, and there should be support centers, crisis centers, helplines, so that any person who is either severely depressed or has the risk of committing suicide can immediately, urgently can seek help and can receive help.
Schizophrenia is a group of disorders characterized by gross disturbance in thought, behavior, perception, and emotions. It appears in late adolescence or early adulthood. Schizophrenia is devastating, not only because of the emotional turmoil and the confusion and fear they produce, but due to its social consequence for patient and family. Psychotic symptoms of schizophrenia are delusions, hallucination, incoherent speech, inappropriate effects for at least 1 week in an acute phase of gross disturbance, continuous signs of disturbance in behavior and functionality for 6 months, present or absent prodromal or residual symptoms like social isolation or withdrawal, bizarre behavior, impairment in